The American College of Obstetricians and Gynecologists has once again brought together thousands of experts from around the world to discuss the latest in obstetrics and gynecology. Stay tuned as we will be covering key topics from the meeting, hearing from leaders in the field, and highlighting organizations working hard to improve healthcare for women. ACOG TV starts right now. Patient-centered and patient-forward care is the future. Let's take a moment to hear from a couple of leading experts about why this has such an impact on better health outcomes.
When we talk about respectful care, what we mean is ensuring that the person we're caring for is at the center of all that we do. It means focusing on support and dignity, focusing on agency and autonomy in the delivery of care. And although as OBGYNs and care providers more broadly, we often hold this as a value, it doesn't always come through clearly in how we care for individuals and also in the community that we serve.
Respectful care is an incredibly important part of being an OBGYN and providing comprehensive, compassionate, and non-judgmental healthcare to our patients.
We know, and we have always known, that the care a pregnant person receives during their labor and pregnancy and delivery and the postpartum period, in fact, has long-reaching effects on them and their child and their entire families, both physically but also emotionally. Feeling safe and feeling supported, feeling heard is a critical part of this.
While I may have the medical and scientific expertise, the patient sitting in front of me has expertise in their own lives, in their lived experience, in their culture, and where they're coming from. It's really important to understand where they are in their knowledge of what they're looking for and understand the fact that they know what they need. They may need a little bit of information from us about the science or about the medicine, but ultimately, respectful care means trusting the person in front of you to make a decision that makes sense for them and for their family.
The unfortunate part about the healthcare delivery system is that clinical care in many instances has been designed to prioritize the needs, the desires, the preferences of the systems and structures we work in. Racialized medicine is part of our legacy, and that's not all in the past. We continue to see an equitable treatment of individuals that is deeply rooted in stratified reproduction, and that directly impacts reproductive health outcomes. It undermines community trust in us as providers and also in the healthcare system more broadly.
We as a healthcare system and as a community of physicians need to acknowledge that that history is ingrained in those communities for good reason. And that skepticism and fear of and mistrust of our system is ingrained in those communities for good reason. And the way that we can help break that down is by demonstrating with our actions that we are willing to be humble and acknowledge that history while also offering as much trust as we possibly can garner with our patients through listening and ensuring that they have a place to be heard and communicate.
The fact that communities most impacted by COVID-19 are the same communities that experience inequitable health outcomes in maternity care and reproductive health more broadly is not a coincidence. It is in fact the result of centuries of structural and systemic inequity. COVID-19 simply laid those things bare. And so the question for us, the question we must grapple with is, what is our unique role as medical providers in this moment in time? Who has access to health and wellness and who does not? And we must use those to move forward and to create new systems that really organize those that are on the outside of care and create systems that really provide equity for all of us.
In the U.S., we have a maternal mortality crisis that needs to be addressed. Let's take a look at what steps are being taken to decrease maternal mortality rates.
There are a number of contributing factors to why the United States has one of the highest maternal mortality rates compared to all developed countries, and why that mortality rate is increasing. One of the most glaring reasons is that there is a Black maternal mortality crisis that has really gone unchecked, with Black mothers being 3 to 4 times more likely to die of childbirth and during pregnancy than white mothers.
Stereotyped notions about who Black women are, the ways that sort of their concerns can be dismissed, the ways that their pain is not believed or mismanaged or undervalued. I think that we have a lot of room to grow as a profession in this clinical space about how we provide more woman-centered care, and also how we sort of elevate the level of partnership and basic respect that we're giving to women, and in particular to Black women.
Although there are many complicated medical issues that can contribute to maternal mortality, we know that standardized care in the approach to obstetric emergencies can reduce maternal mortality. So responding to hemorrhage in a team-based standardized fashion, and responding to severe maternal hypertension using well-established algorithms can reduce maternal death, but we don't see those practices being used equitably across the United States and across all mothers.
When we talk about the structural and systemic inequities that disadvantage people from the womb, right, over the life course from the beginning, that those cumulative stressors, those chronic conditions, then you add in racism, sexism, classism, is kind of where I started. Those are the conditions that bring people to us for clinical care kind of already starting off at a disadvantage. So I truly believe that advocacy and really looking to create more just and equitable structures and policies and laws and communities are going to be the ways that we can take a stab at a primary prevention opportunity, so that when we're hoping that we could see more equitable outcomes on the back end.
Doctors should be very involved with supporting and advocating these policy changes that will go to increase funding to community-based organizations, address those issues around maternal mental health, even address the environmental health concerns that can lead to inequities in maternal health outcomes.
The greatest thing that we've been able to gain an appreciation for is how much of this morbidity and mortality is occurring after our clinical encounter is done. So, in that postpartum period, we really underestimated how important that year following pregnancy is in the life and health of women.
Presently, under Medicaid, states are required to only cover postpartum care through 60 days postpartum. So, in spite of providing healthcare through pregnancy and identifying critical medical conditions, mental health disorders, we are not able to continue that care in the time when mothers most need it. The American Rescue Plan is providing that opportunity right now for states to amend their state health plans to include Medicaid through that first year postpartum. And we certainly applaud the states that have taken action on that, like Illinois, who's passed that waiver. And we're looking hopefully forward to more states taking advantage of this until we have a national policy where all mothers can get the care they need through that first year postpartum.
Stick around as our tour of organizations that are at the forefront of gynecologic research continues. Let's start by taking an in-depth look at Axia Women's Health, a national community of nearly 400 women's healthcare providers committed to delivering more caring, more connected, and more progressive healthcare to women.
Looking ahead, I'm really excited about the technologies that we're partnering with and the new data that we'll be gathering and being able to use that for patient care in the future.
Next, let's head to the Division of Gynecologic Oncology at The Ohio State University Comprehensive Cancer Center, where they are at the forefront of the nation's efforts to find the most effective ways to prevent, detect, and treat gynecologic malignancies.
At The Ohio State University Comprehensive Cancer Center, James Cancer Hospital, and the Solo Research Institute, our vision is to create a cancer-free world, one person, one discovery at a time. Ours is the only cancer program in the United States that features a National Cancer Institute designated comprehensive cancer center aligned with a nationally ranked academic medical center and a freestanding cancer hospital on the campus of one of the nation's largest public universities. Having a comprehensive gynecological oncology program really puts the patient at the center of a totality of an extensive multidisciplinary team. So as gynecological oncologists, not only do we do surgery, chemotherapy, end of life, but you bring in the most important aspect of a patient's care, the rest of the team.
Next, let's take a look at the GoG Foundation, a nonprofit organization with the purpose of promoting excellence in the quality and integrity of clinical and basic scientific research in the field of gynecologic malignancies.
Every time I lose a patient to cancer, I just get I get fired up. I get mad and I get motivated, and I just know that we have to do better.
Being a part of GoG, it allows you to actually change care. It allows you to move cancer care forward.
How do we do that? We do that with clinical trials.
The GoG has a 50-year history of developing new therapies, transforming the standard of care.
It's thrilling to be able to say, I have something new for your disease, to say that overall survival is improved as a result of a study we recently completed.
This is about helping people that are sick through collaboration with an investigator, an institution, and the organization, which is GoG Partners.
Lastly, we are going to learn about Applied Medical, where they develop innovative products that improve patient outcomes and enable the advancement of minimally invasive surgery.
The V-Notes procedure and my surgeon, they have made it possible for me to just have a little blip on life and just keep going, and I feel so much better after the procedure.
Well, that's it for us this year, but we hope that you've enjoyed our show. For more exclusive material from the 2021 Annual Clinical and Scientific Meeting, make sure to visit the ACOG TV YouTube channel. We hope you've enjoyed your virtual experience, and we'll see you next year.